Broadcasting from the business capital of the world, this is the Podcast Business News Network. Welcome back to the show. Dr. Leslie Koenig joining us here today. Excited to have her here. She's the owner of ketamine therapy at Waybridge Ketamine Clinics, based out of Omaha, Nebraska. She's helping so many people and really is back here to talk more about the benefits and advantages of using ketamine therapy. So first and foremost, welcome back to the show. Would you mind just introducing yourself to our listeners to start?
Hi, yes, I am Dr. Leslie Koenig. I own the Waybridge Ketamine Clinic in Omaha, Nebraska. I'm an emergency physician, combat veteran from the Navy as well, and I have this clinic now, hoping to share it with the world.
Perfect. And how do we find you?
Waybridgeclinics.com. I'm also on Instagram as Leslie Koenig, Koenig MD. So Leslie Koenig MD.
Awesome. And how many locations do you have?
We have one, soon to open a second in Nashville, Tennessee.
Oh, good, good, good. It didn't open yet. All right, cool. Well, for today, I know we're going to get started and just do a little overview about, ketamine therapy, what it is, and we're definitely going to dive into, some personal experiences of people who've been using this. And, what do patients typically experience as they start ketamine therapy?
Well, I'm so glad you asked. The ketamine experience varies greatly based on the environment in which you do it, which is why we have an in-clinic setting. And so most patients experience a very safe setting where it is kind of curated from start to finish with essential oils to start with. You settle into a comfortable recliner in an individual room. And then we give you blankets, weighted eye masks, headphones, and a music playlist that starts with a meditation. And then we go into La La Land, as some patients describe it, during the ketamine infusion, which is a bit like a dreamlike state. It is a dissociative anesthetic.
Okay.
So there's that dissociation that happens, and your consciousness kind of drifts away, and then you drift back into the room.
Interesting. And how long of a course, a period is it, and how long does it feel compared to what it really is?
So the actual infusion is 40 minutes. And
Okay.
the feeling of it is that the time is actually a very common, there's a dilation of time with being under ketamine. As anyone who's done surgery can tell you, when you go into surgery, time isn't quite the same. You go to sleep and you wake up and you don't know at all how much time has happened. And sometimes that happens with ketamine.
Wow.
So it's variable, but usually it feels, about like a good night's sleep.
And what are some of the long-term benefits of this?
Well, that's the great thing that we do with the IV ketamine is that the one infusion can last for weeks to months, and the long-term benefits are a drop in depression. So that's the whole reason that we do it is because most people are so used to having to take a pill every day for years and years. But ketamine, we hope that in just the 6 sessions, we can certainly make you not have to take pills every day. So long term, you can experience dramatic improvements in depression, PTSD, anxiety, and chronic pain.
Oh my goodness. Wow. And is there also, any short-term benefits that you get too, on top of the long-term benefits?
Oh, yes, absolutely. So most people will say it's like a spa day for their brain. They'll have come in feeling like just weighted down by the world. And most people will say that they will very much look forward to the infusions because they know that afterwards that lifting of their mood will happen, which is the whole idea of why we do it for the mood improvement. So their depression lifts, anxiety seems to drift away, things aren't as bothersome, and you're able to respond instead of react so that things that a therapist may have tried to teach you, so certain skills will just kind of set in more. So usually people are very excited for their treatments and wake up feeling just lighter.
Got it. And now, how do patients feel? I'm sure probably both different sides, right, about their decision to undergo this and to try this. Some are okay, some are more anxious than others.
Oh, absolutely. I would say that it's normal to feel anxious trying a new medicine. And then, especially with this being an IV involved, so there's a needle stick, but we do everything we can to mitigate that. So help people feel better when they come in with all of the comfort measures that we do. So people, when they walk in at first, it's understandable. You're not quite sure what you're getting into, which is why we prepare everybody with a meditation course to start with. Every session starts with a meditation with gentle music to go into it. So thereafter, after the first one, most people very much look forward to it.
Got it. And then now just also have to ask, for those out there saying, well, is there any advice you can give me? What for, someone who wants to try this, what advice would former patients maybe even have for those that are coming into the office now?
Well, the first thing I would say if you have not done ketamine is to talk to your physician about it. Whoever's been prescribing your mood medication or your depression, anxiety medicine is to ask them first. And then if they don't know about ketamine, direct them to me. I've actually come into that a lot where patients will say, I heard you talk. I asked my doctor. My doctor had just as many questions as I did. So I'm
Okay.
happy to educate other physicians if your physician doesn't know, but they're usually a very good resource to start with. So yeah, that's a great place to start. And then other things I would tell them are to visit our website, visit my Instagram, and other things to prepare for would be the meditation course that we offer all of our patients, but also to look at kind of the brain health category of things. So, for example, minimizing, like right now, it being October, horror movies. You don't want to be filling your brain with horror type pictures because that can play into your experience. And then
Interesting.
mitigating your social media and news intake. So you just want to like decrease that sensationalism in your mind.
Oh. Now, what about, side effects? Could you just share a little bit about that? What some people could suffer with? I'm assuming the positive outweighs the negative, but could you share some of those so people are, understanding that there are risks involved with everything we do, right?
Oh, absolutely. And I'm so happy you asked that. So the key thing about any of the risk is this is another medication and it's another pharmaceutical. So we always want to go over that with people so that you can have a balanced decision. But yes, obviously, we feel that the risks are outweighed by the huge benefits have to offer. But the risks usually right away are some nausea, which is why we give patients nausea medicine in clinic. However, we also advise that people don't have anything to eat or drink prior, just like going into any surgery, because this is like a mild sedation medicine.
Mm.
Um, and then also there are some blood pressure elevations and heart rate elevations that can happen, which is why we do continuous vitals monitoring. And some people feel the need to go to the bathroom. So we have a bathroom in the clinic. And then following, there's, it's kind of like waking up after some sedation. Like it's like taking a Benadryl, where there's just that sense of being tired can persist for a couple hours. So we recommend that people have a ride home. But then let's see what other risks. The other risks tend to be with very high use, um, like recreational, very high dosages that are not physician prescribed,
Hmm.
which usually are very not concerning at the doses we do. Other things that the risks that we want to discuss are if you're pregnant, this is not recommended or any history of uncontrolled blood pressure, uncontrolled heart issues, we would want to not go there due to the blood pressure issues. And then any history of mania, we would, because people feel so much better with the bipolar ones, it can trigger going into a manic episode. So not that that's a risk, not that that's a
Okay.
contraindication, but we definitely watch that.
All right. Good to know. What else about ketamine therapy do you think is important for our listeners to know? I don't know if you wanted to kind of back up about, the safety and regulations. Did you want to jump to number four or?
Oh, sure, sure. Well, safety regulations is honestly the biggest question I get is ketamine, is that legal? And I'm blown away by this question because the safety and regulations about it are that yes, ketamine is 100% legal. It is in every hospital. Just about every pain doctor will also utilize it. And it's on the WHO list of essential medicines because it is so safe and so effective, and it is 100% legal. But it is a controlled substance, which is why we work very closely with the DEA and make sure that everything is by the book, that we monitor everything appropriately, that we track everything appropriately. So, but it's very safe, very effective, and we just want to do it right and dot every I, cross every T, so that again, all the safety and quality measures are rigorously adhered to.
And who like you mentioned, is it the DEA? What is the terminology? I'm sorry. Who
Oh,
oversees the
the Drug
regulations?
Enforcement Agency.
Drug
Yeah.
enforcement. That's what that means. Thank you so much. All right, all right. And then
Yeah,
what
yeah, of
about those
course.
also working at the ketamine clinics, right? Don't they need to have certain qualifications as well?
Oh, absolutely. So a medical doctor, and we employ all medical professionals who give the medicine. So we have a doctor of nurse practitioner, who is a very experienced, also from the emergency room. I'm a board certified emergency physician. And we have a EMT or emergency medical technician who's also on site all the time. There's never, I've heard horror stories that I just, we have such a high standard that I feel the need to just apparently say we are all medical trained staff certified in our state, licensed with the DEA, board certified, many years of experience, past background checks. And we do not leave the clinic when a patient is undergoing a sedation. We treat it very seriously because this is a powerful medication that has very wonderful benefits, but it has to be done right, which is what we aim
Got
to
it.
do.
So how does someone maybe who's not in your area or in Nashville, like, know, how they're going, where to find a reputable clinic?
Oh, sure. So there is a group of physicians called ASKP3, or I believe it's the American Society of Ketamine Physicians, Practitioners, and Providers. That's usually a very good resource to check.
Good.
And in this, it's kind of a small area. And so I've definitely networked with people across the country, and people are free to call us up and let us know where they are, and I can certainly make a referral for
Great.
whoever is might be in your area.
Great. And how can we contact you?
Uh, waybridgeclinics.com. There's also an email, hello@waybridgeclinics.com.
Perfect. And, as far as insurance, does insurance cover any of this for a certain chronic condition, or is it all out of pocket still nationwide?
That's an absolutely great question. We are getting credentialed with a number of insurances in here in Nebraska in this state, and we are getting some payback from the insurance companies, but it's very individual, which is why we are advocating as much as possible from different insurance companies and working with different coders to get the billing just right so that we can get as much of your money back. But currently, it is a cash model, but you are free to bill insurance. We do offer super bills. Oh, and the
Ah,
VA will also pay for this in the Nebraska, Iowa region.
perfect. And if someone does want to reach out to you directly, let's just want to remind them again at this time because we're about halfway through. It's waybridgeclinics.com. That's WAYBRDGE clinics, CLINICS.com. And just for those who don't know you yet, just a little bit of your backstory as you're a qualified medical doctor, and how did you discover the benefits of ketamine and then to start to open your own business like this? That's a pretty big task to take on, but you clearly, I know you have a good, passionate story.
Oh, yeah, absolutely. So I was in the military for 8 years. I was in the Navy. And in the Navy, we used it on the battlefield, but also I used it in the emergency room setting as a added pain benefit. So many patients, when they are in pain, will come to the ER and get opiates. So Percocet, oxycodone, Dilaudid. And in the ER, that can be very helpful. Although Toradol is another one, for example, kidney stones, I give that one quite a bit, but it's like a IV Motrin. And what we found in the military was a low dose infusion of ketamine could help quite a bit without having all the negative things that come with narcotics, like Dilaudid and Percocet and fentanyl, for example, is another one that emergency doctors typically have. So in the Navy, I learned this protocol and I found that it worked amazingly well. I was very surprised because mostly I use ketamine as a sedative for procedures in the ER, like a quick on, quick off, procedure if I had to set a bone or do a laceration, or we do cardiovert somebody, basically shock them out of a certain heart rhythm. We could do ketamine. However, long story short, I was looking at getting out of doing night shifts. I was doing night shifts for 5 years and I had an interest in integrative medicine
Wow.
and I wanted to open my own clinic. So I talked to some other emergency doctor friends and this kind of landed in my lap in the craziest of ways where it was just in 1 week, it was like boom, boom, boom. If you believe in a higher power, I feel like that's exactly what came my way. It was like I was told Leslie, Dr. Koenig, you are going to open a ketamine clinic because the world's higher power has told you that this is what's going to happen based on a number of coincidences. It was very odd. So, yeah, long story short, I basically feel like I was told to
Oh
start
my
it.
goodness.
But then again, I had the experience and know-how that all led up to that.
Beautiful. Thank you for that. And again, let's remind everyone to go to the website, waybridgeclinics.com. And, with your ketamine clinic, and I know you're expanding, you mentioned now to Nashville, Tennessee. How is that going, by the way? When is the grand opening officially?
Oh my goodness. The grand opening, I hope, will be about mid-December. We have a local emergency doctor hired, and we are actually interviewing additional staff right now. However, we have the location in Green Hills, in the Green Hills area. And it's just exciting. We have the lease signed. We're getting all of our equipment sent in. We have all the medication that we're going to be getting in there. So supply is often an issue in ketamine clinics. However, we have that covered, so we should
Huh,
be able to start offering in December.
perfect. And as far as, working and being here in the ketamine clinic, are you still practicing medicine elsewhere as well, or is this your full-time now baby in a sense?
It is my full time. However, I do still work in the emergency room about once a month. I really, truly love emergency medicine and just the variety of it. I love all my old coworkers, my staff. Being able to see patients and make them feel better quickly is what every emergency doctor loves. And so it was really cool that I was able to take that same like immediate gratification in medicine from the emergency room to now with ketamine, because ketamine is the only rapid acting antidepressant basically out there. I'm able to do a very similar
Wow,
thing where patients who are suicidal, patients who are depressed, I can give them this medicine and they feel better rapidly. And also, they are able to go off and live their lives. And hopefully, it's a bit like the emergency room. We want to treat you and make you better. And please don't come back unless it's an emergency. And the
got
same thing
it.
with my clinic is that I can treat you, make you feel better, and hopefully you don't need to come back. It's not like you need to come back for dosage adjustments after you've gotten your
That's what
foundation.
I was going to ask. Do people
Ideally you
do this
see me. Yeah.
continuously, or is it you want to wean off it in a sense and graduate? How do I use that? Yeah, the correct terminology for that.
Oh, yeah. No, ketamine is not designed to be a regular intake. The analogy I give is when I live in Nebraska, so everything is agricultural based. So when you plant a tree, like an apple tree, for example, say you plant it, there's a lot of like right up front, you have to take care of it with a lot of fertilization and a lot of watering. So a lot of upfront maintenance. And then after that, you just treat it like normal and you don't have to do as frequent attention. So that's the kind of the way we want to go with this is you take a person who has had depression, give them the ketamine through the foundational series of 6 sessions. And then ideally after that, if needed, do boosters. So there's like that right up front foundation, and then if needed, come back. Now, that being said, usually it's only in the first year or two that people need boosters. And there are a segment of people who do need to come back more frequently than that, but I would say that's a minority. It's a smaller percentage. So most people, the series of 6 with boosters over the next year or two. And those
Good.
boosters, by the way, are spaced out every few months. And it's very individual. So we work with each person one on one.
All right, but we still got 5 minutes left in the show. What else do you want to make sure we cover for today in particular about this ketamine therapy and, the benefits and who it's helping?
Oh, yeah. It'll help anybody with depression, anxiety, PTSD. And I think earlier I skipped over talking about finances, like
Oh,
financial
sure. Oh, yeah,
situations with
yes, yes,
insurance.
yes.
And so while insurance may or may not cover it, we wanted to still offer it to people and have an option of care credit where it's like a credit card for this. So
Okay.
that way you can have financing for this. It may look like a big number up front and that can scare people off. However, the goal is that this is an upfront investment in your mental health. There's so many things that happen that are priceless that ketamine can offer, like improvement in relationships, motivation for your job, motivation to live your life. And you just can't put a number to that. However, we do want to offer that we will work with people. We do offer veteran discounts frontline healthcare workers and healthcare workers. That's an amazing thing, is how many physicians and nurses are our patients. I think it speaks to the fact that the medical field is very burned out and looking for better solutions. And there's nothing to fear with ketamine. People in the medical field are coming to my clinic quite a bit, which was a big surprise to me. However, this is financially an option for anybody who wants to give us a call, and we can help you with financing there.
Awesome. Good to know. And, people do hear, some of the downfalls of it and the illegal aspect of ketamine. We talked about Matthew Perry months ago because unfortunately a lot of people ring a bell with hearing, those horror stories, stuff like that happens to people over abusing, and selling it illegally, let alone it's probably not even the right drug, right? I'm sure it's not what we think. And I just want to point that out. So it could be sound, detrimental at times, but that's different. I just want to point that out, right?
Oh my goodness. I'm so glad you brought that up. And the thing about Matthew Perry is it was more of his medical team. I feel like really did him a disservice by letting him do it at home in a hot tub. And not only that, but ketamine is so safe and it is legal. Like compare that to the opiate crisis. How many people have, and like that's legal, right? That's legal to take in a pill at home. And that's highly, highly addictive. And
Hmm.
ketamine, there's one person out there that people think of Matthew Perry, and you forget the thousands of people who have died from Percocet and oxycodone.
Yep.
And it's so sad. It really, really is. Because ketamine has the ability to help with addiction. And that's a big reason why Matthew Perry, I believe, started it. However, you can abuse anything. People abuse Benadryl, people abuse all kinds of medicines out there. And that's why, again, ketamine it's regulated by the DEA, administered by healthcare professionals like myself and my staff. And it really is, the goal is to make you get better safely.
Awesome. Wow. And, back to, your experience with this. Obviously, you are a well-equipped, well-certified, you mentioned board certified and everything else. And what would you say to someone who is maybe, thinking about ketamine therapy? They've heard about it. You know, what is the anxiety? Brings more anxiety on sometimes, right? To try something new like this. Can you sign up to try one? Or I know it's recommended to do at least six, but what if someone's scared to commit to that full six that, just curious, at least six, you said.
Oh yeah, yeah. I mean, I would say number one, do your research. And it comes down to um, feeling safe with the people who prescribe it. And this is a prescription of six based on the evidence out there. So, Yale, Stanford, all of them have formulated this foundational series. It's kind of it's kind of like if you want to eat a meal and get full to actually get the benefits, really sign up for all of them
Yeah,
for the six, because again, that's like you can't just like plant a tree and water it once.
it's
It
so
just doesn't
true.
work that way.
It
Yeah,
is,
you have
right?
to do
Oh
the
my goodness.
yeah.
I know. I get it. I get it. But I'm hoping people reach out again, Omaha, Nebraska, and then now the new Nashville location coming up. And would you mind just sharing again how we can contact you before we go?
Yeah, and if you want to give us a call, 402-965-1371, and waybridgeclinics.com, you can fill out an intake there. We do free video consultations for anyone interested and answer your specific question.
Perfect. Thank you so much. Always a pleasure having you here. Great to see you back today as well.
Yeah, thanks
And
again.
we back on next week or the week after.
I think it's next week.
All right, good. Well, looking forward to it. Hope you have a fantastic day and enjoy the rest of the week.
All right, thanks, Jill.
Thanks again to all of our listeners and viewers. Stay tuned. We'll be right back with more.
Are you looking for even more of the podcasts and hosts that you love? The Podcast Business News Network is proud to announce that you now have even more ways to listen live. Check out the MyTuner Radio, online radio box, and Simple Radio apps on iOS and Android, or find us online. Search for Business News Network on mytuner-radio.com, or search Podcast Business News Network on streama.com and onlineradiobox.com/US. Take your podcast on the go and don't miss a minute of the action.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.
For nearly 2,000 severely injured veterans, everyday life has become filled with barriers.
Day-to-day simple tasks can become pretty daunting.
I have to carry my chair up 2 flights of steps or have somebody do it for me.
What scares me the most is just the falling.
when I'm struggling with my house, I think, to have that one great barrier just knocked down, I mean, it's crucial.
Home for Our Troops is a wonderful nonprofit that builds a
Mortgage-free, fully adaptive, handicap-accessible house. And there's no catch.
It'll be our very first home that we've ever owned. This is a game changer.
This is where your life begins again.
We need you to join us in completing this important mission. Please visit hfotusa.org and help build homes and rebuild lives.
Because of you, everything's going to be okay.